Thank you, Dr. Luna and Dr. Robinson. Happy to take questions.
Thank you, Dr. Arwady. 20 to 25,000 initial doses, not a lot, really. And do you give out all of those, or do you say half because it's a two-shot process?
Yeah, good question. So the 20 to 25,000 is the number of first doses that we would expect to give, and there's already, for any first dose that we give, a reserve in place for that same 20 to 25,000 to be able to get the second dose. We don't know for sure exactly how much we'll get, but that is the estimation based on what the company has said is likely to be available at the beginning. We are anticipating literally every single week getting additional allotments. So our expectation is that that first week may be 20 to 25,000. If, for example, that's the Pfizer vaccine, if the Moderna vaccine is coming along just 1 week behind that, we would hope to not only be able to receive additional Pfizer vaccine, but be able to receive that first dose of the Moderna vaccine. And there's a federal system that's set up that basically allocates vaccine based on population, but then we have to be able to show that we are using that vaccine appropriately here. We have very good plans that will allow us to continue to scale vaccine at whatever rate it is made available, but we are quite dependent on the timing of when vaccines are available and then the production of these vaccines.
And then how is it done equitably so that all of the city receives it and not just perhaps those with means to know and listen and hear all the information and know where to go?
Yeah, absolutely. So as you heard, the first prioritization is very much based around healthcare workers. And so we've been in close communication with our hospitals, but also our outpatient healthcare providers, our long-term care facilities, to ensure that they have the information for this work at the very beginning. We know there's not going to be enough vaccine to vaccinate even all of the healthcare workers who work in hospitals, for example. And so lots of conversation about what that looks like. Once we get past this very first and we start being able to think about who comes next, again, we are dependent on those federal guidelines that will come through ACIP and through CDC. But we anticipate, for example, essential workers being part of that next tranche of who this is made available to. And we'll be working very hard, as you've seen us do for testing and everything else, to make sure that we are pushing messaging, that we are encouraging a lot of extra sort of outreach in areas that have been hardest hit by the vaccine. And so this Protect Chicago initiative that we launched a number of weeks ago has both a broad component where we're thinking about getting messaging out sort of digitally and broadly across the city, as well as very focused, even door-to-door work in a lot of our census tracts that have been hardest hit. The vaccine will fold right into our Protect Chicago campaign. And so as there is messaging available, we've thought a lot about how we are able to kind of get that messaging out there so that people know when it's available to them. And then finally, I would say we're doing a lot of thinking and planning about how to create the space for conversations at a community level, thinking about pairing healthcare workers who work in certain zip codes and are feeling supportive of the vaccine and willing to spend some time, pairing those people up with community leaders, church leaders, groups who are interested in having conversations, especially in communities of color here in Chicago, where we're anticipating perhaps less initial uptake, partly based on some of that history. Is that good? You want? Okay.
Are the hospitals already, or perhaps they already have this, but are they getting new refrigerators? Are they getting equipment? What's going on behind the scenes that we don't see?
Yeah, certainly. So that Pfizer vaccine in particular is the ultra cold vaccine, the one that requires the -80 Celsius. Even the Moderna vaccine, it's not the ultra cold, but it is much colder than vaccines typically need to be. And some of our hospitals in Chicago do have some of that ultra cold capacity. And where a hospital has that ultra cold capacity, they can receive that shipment shipment more directly. But most of our hospitals don't have ultra cold capacity, and we have absolutely committed at CDPH to ensuring that all hospitals are able to get that vaccine really approximately at the same time. So we've built up at CDPH the capacity to handle more than 130,000 doses at a time, even of the ultra cold, and have plans to be distributing to the many hospitals that don't have that ultra cold capacity. There's a lot of logistics in that, but we felt very strongly that we wanted to make sure all hospitals, including smaller safety net hospitals, would be getting access to this vaccine. And even the distribution there, we've done equitably based on their numbers of employees and their numbers of especially these higher risk employees directly caring for COVID patients.
Is this, and maybe I should know this already, once you get the vaccine, do you have to do this every year? Or is it one and done?
Yeah, we don't know yet. We know that there will be certainly 2 doses of vaccine initially. So both of these first 2 vaccines that we're talking about, you get a first dose and then you get a second dose, either 21 or 28 days later. We haven't even had COVID on this planet for a year at this point. So there's not been the opportunity to really do some of those longer term immune studies that we'll need to do to fully answer that question. I think a lot of vaccine experts are feeling optimistic that this won't be an annual vaccine. Partly that's based on the fact we've not seen a lot of mutation in the COVID virus itself. That's very different from the flu vaccine, which we see a lot of mutation. There's a lot of different strains. And so every year you have to create a new vaccine. Partly, we haven't seen a lot of that mutation because we haven't developed a lot of medications to treat it. There hasn't been a lot of pressure for mutation, so you could see some changes there. We know that some other coronaviruses, natural immunization doesn't last that long. And certainly a question I get a lot is, if I've had COVID before, do I need to get the vaccine? And the recommendation is yes, because we are not sort of trusting whatever. There's a lot of variability in terms of levels of protection and how sick somebody was. So these are some of the questions that will be answered. Even if this turned out to be an annual vaccine, it might be something that we gave annually like the flu. That would still be very effective. But I think it's looking promising. That it would have some more longevity, but it's just too soon to know for sure.
Are there discussions underway that once you're vaccinated, that you would have some kind of, I don't know, whether it's on your phone or you walk around with a certificate that allows you to go to restaurants, bars, sporting events, concerts, and all of those events where more people gather?
Yeah, so that is a big conversation, as I'm sure you know. And a couple things I can say. First is that there's been a lot of work to make sure that as people are being vaccinated, their information is being stored privately, but also in a way that will keep track of who has been vaccinated with which vaccine, have they gotten both doses. The CDC is setting up a post-vaccine monitoring system where people who are vaccinated will have the ability to receive text messages, to be able to report if they have any side effects or any concerns, to have some follow-on. And certainly, I think down the line, we may see some employers or businesses, requiring vaccine. We are not anticipating at this point a sort of a city requirement around vaccine or a national requirement around vaccine. And in this early stage where it's still under emergency use authorization and where it's just not widely available, we would not anticipate vaccine mandates in any setting. I think time will tell as more vaccine becomes available, decisions that are made in that regard. But this is absolutely people electing to take the vaccine at this point. We certainly are. I'm very optimistic. I'm thrilled with at least how this preliminary data looks. I am certainly planning to be vaccinated myself very early. And I'm very hopeful that we'll see healthcare workers and others who are early available, and then essential workers really taking advantage of the opportunity to protect themselves and their community. But this will be a choice that people will have, particularly early on.
Also, can you clarify, there are all the questions about probable cases versus real cases. Do you update your system so that do you go through how often do you do that? Because aren't the probable listed as yes? And perhaps maybe they're not.
So the definitions for probable and sort of confirmed cases are based on the kind of test that someone has had to diagnose them with COVID. And so the confirmed cases are based on people who have had a PCR test, which is the gold standard test that we've been using for months. More recently, we have seen these antigen tests emerge. They are tests that instead of looking for the genetic material, the RNA of the virus, they look for a protein that the virus produces. So they're more like a pregnancy test or something in terms of not looking for genetic material. They're able to be made more cheaply. They're able to be done faster. You lose just a little bit of the accuracy when you do them. When you have as much COVID as you have here in Chicago and here in Illinois right now, even a probable case is almost certainly a case. It becomes more of a problem when we're in a lower risk setting and you could have more potential false positives. So the Illinois Department of Public Health is including both probable and confirmed cases within its case reporting. And for all intents and purposes, with the amount of COVID we have right now, we absolutely recommend that people who have a positive antigen test treat that as an actual positive. There's not really a difference with the amount of COVID we have right now.
From the Chicago Tribune, will Chicago follow the state guidelines for distributing the vaccine for the general population, or will it get some of its own additional guidelines? So the whole country, whether it's the state, whether it's cities, has to follow the federal guidelines, just to be clear. The ACIP, or the CDC, through the CDC, makes the recommendations for vaccinating, and we are receiving all of this vaccine free of charge. And we are required, and anybody who is vaccinating, any provider eventually who is vaccinating, has to certify that they will provide vaccine following these guidelines. So all of the prioritizations at the high level are set federally and then they are implemented locally. Chicago actually does receive vaccine separately from the state of Illinois. And that is because we're one of the large cities in the US that for years and years does receive direct CDC funding and direct vaccine for immunization. So all of our childhood vaccines, our flu vaccine, all of that comes directly to the Chicago Department of Public Health, and we have the responsibility for vaccinating within the city of Chicago. The Illinois Department of Public Health would have the responsibility for vaccinating basically everywhere outside of the city of Chicago. We're in very close alignment there. There's a lot of conversation about the details, and I don't anticipate significant differences at all in things like prioritization because those are set federally. We will be receiving vaccine based on our population, just as the state will, and we will be allocating that and really working to push that out as quickly as we're able to. I think you addressed this, but the Trib is also asking, will it be equal by neighborhood, or should areas hardest hit be prioritized?
So again, we have to follow the federal guidance there, and that has not been formally released. We are anticipating that the way this will be prioritized will not be by neighborhood per se, it will be by risk. And so starting with healthcare workers, probably next coming with essential workers, next, and people who are over 65, people with these underlying conditions. What we are anticipating at CDPH through Protect Chicago is that we will do additional outreach efforts, for example, in neighborhoods that have been hardest hit to ensure that there is good knowledge about how to get vaccine as it is available to the population. We also, when there is more vaccine available, will absolutely be looking to our clinical partners. We will be distributing Chicago's vaccine allotment to outpatient clinics, to private practices, to federally qualified health centers, to pharmacies, and encouraging people to be able to get vaccinated through their trusted healthcare provider. That's really our goal in the long term. So we do not anticipate at this point an allocation per neighborhood. We want to make vaccine widely available, certainly throughout Chicago. It will be prioritized based on risk, but we've seen that essential workers, for example, are more likely to live in some of the neighborhoods that have been hardest hit. And so in that way, those neighborhoods would be prioritized.
And so how, and this is from Craig Wall, how will essential workers be prioritized?
So again, and I have to just keep putting the caveat on this, that this is will be based on when federal guidance, when this is released. We are anticipating that this would follow the same essential worker categories that were defined, early on at the federal level and that were used here in the state and city around stay-at-home, et cetera. And what we are anticipating, again, there's going to be a lot of planning on this, so it's premature to be able to talk specifically. But what we'll be thinking about is, are there employers, for example, who we can help support or connect? So a grocery store chain may work to be vaccinating its workers. A school system may work to be vaccinating its employees, a transportation system, et cetera. Certainly the Chicago Department of Public Health is anticipating standing up some larger mass vaccination sites. Those will be available certainly initially by appointment. And so this would be work, again, outreach to essential workers, working to get them an appointment, either with their healthcare provider, if the healthcare providers have vaccine at that point, or through some of the city's mass vaccination efforts. And we'll be working to reach people who are essential workers, and especially reach people who are in the neighborhoods that have been hardest hit.
All right. From Block Club, what is the ICU bed availability in Chicago proper?
So it is, if you go to the website, chicago.gov/coronavirus, right up at the top under latest data, if you pull down to hospital capacity, you'll see those numbers every single day. When I looked at it this morning, we were at approximately 25% availability. It's somewhere in the 25 to 26% range.
That's not good.
It's, we're pretty full. We want to see that number stay over 20%, certainly. That's across the whole system. So, you can imagine we've got some hospitals that are very full and some that have a little more capability. But we've got more than 1,000. We've got more than 1,000 patients in the non-ICU, close to 300 just with COVID in the ICU, and we haven't even seen flu season hit yet. And so we are appropriately concerned about how this second COVID surge has already been hitting our hospitals, and that it has the potential to sort of hit them even further. We had dipped down to as low as just around that 20% availability mark, and we start to get really worried if we see that drop below that. So we watch every single day. We get numbers on both non-ICU and ICU and ventilators, and the reason we're up here every day asking people to wear their masks, not have people over into their homes, not travel, really stay home, except for going to work, school, or unless it's necessary, is because we are seeing a lot of bad outcomes from COVID, and we are seeing hospitals that are quite full already, and the potential to get even worse.
And also from Block Club, could you give more details with those cold storage limitations? How much vaccine will Chicago actually be able to store and distribute at once? And will that slow down the vaccine campaign?
No. So we have built actually a very unusual amount of cold storage capacity for a city. What's that?
Where is it?
Oh, we don't share the details of it for security reasons, but we have a warehouse that is set up and has has a lot of layers of security, but has this appropriate cold storage capacity.
And is that new?
It's new.
I'm sorry to interrupt.
Yes, this is new. So cold storage was not something, this is an example of our emergency preparedness program starting way back in the spring. We bought a lot of needles and syringes and sort of all the other things you need to launch a mass vaccination campaign. And then as we were learning more about these vaccine candidates, we have been purchasing these additional freezer capacity. We have plenty of capacity here for what we would expect to receive related to the ultra cold, because remember, we're pushing it out every week as we get it. And I am really confident in the plans that we have related to distribution.
Thank you. And Ben Bradley from WGN, what's your guidance for people who have had COVID in the last few months and fully recovered? Presumably, could they travel, not wear masks, gather in groups, since there is believed to be a significant level of immunity?
So the problem is significant level of immunity can mean very different things for different people. There are still a lot of questions about how long some level of protection may last. We worry about people who didn't get very seriously ill, didn't mount a very significant immune response, perhaps not having as much protection that comes later. The CDC has broadly said that in the 3 months or so after recovery, there is some level of protection, but there's major questions about how long that lasts and what those levels are like. And there have absolutely been hundreds of cases of people who have been reinfected with COVID. And so it doesn't seem to be the norm, but it can happen. The larger point is that we really need everybody continuing to do the things that we know work. Wearing the masks, doing the social distancing, not gathering. We don't consider natural infection to be protective in a way that we recommend against doing those things. Once we're talking about people who are vaccinated, I will tell you, even in that first time period after people are vaccinated, they too will continue to need to wear their mask, continue to have some limitations. There's still even questions. We know that the vaccine looks like it is protective for the individual. We're still learning, for example, does it actually protect you from spreading? We don't know that for sure. We hope so, but we don't know. And so it's going to be complicated, I think, as we're sort of rolling this out over this coming year, where increasingly we're going to have more people vaccinated and still asking really at a population level to continue to restrict and do some of these personal level activities. As we have a higher percentage of the population vaccinated, we'll be able to start dialing back on some of those restrictions. And I'm confident this is the way that we will get past this and that it will happen in 2021. But it's going to be a combination of rolling vaccine out quickly and effectively, which I'm confident we have good plans to do, seeing good uptake of the vaccine, which I think is a bigger question and will take some real conversation, and we'll be learning about side effects and, this whole conversation going on. And then combined with people continuing to do the things that we know work against COVID as the vaccine campaign is rolling out. I'm very hopeful that by the time we're halfway or in the third quarter of this year, we'll be in a really different place. But it's dependent on all of those things, and very few of those are directly, in the Chicago Department of Public Health's control.
So your goal of, pardon me?
2 more.
Okay, good. Your goal is 70% of Chicagoans vaccinated by when?
As soon as possible.
I know, but realistically, what are you thinking? June, July, later?
Yeah, I think we don't know that exact percentage for sure. It depends how good the vaccine turns out to be, sort of when it's in use outside of a trial. If you have a vaccine that's very effective, like this one seems to be, you can vaccinate somewhat less of the population, as opposed to if you have more to start to get to that herd immunity place. I almost feel like it is foolish to make predictions at this point, because there are so many unknowns and we are just at the beginning of getting started. Certainly, I am anticipating this campaign to really last for a year, give or take. I think we're thinking the first 6 months or so will probably be a period where the health department is playing a fairly significant role, and we're needing to talk about prioritization. And then probably once we're into sort of the second half of the year, we're hopeful that there will be wide availability of vaccine in many settings, and it will be more of following on the people who have had vaccine and encouraging everybody to get vaccinated. But we really just don't know yet. And if I've learned anything from COVID, is that things continue to change month by month. So we're planning for all eventualities here. We really are. And I'm very confident in these plans that we will be able to grow them or shrink them as vaccine is available and as we learn more, with a lot of input from local scientific experts and others who will be helping guide us as we roll this out, and then talking to a lot of community groups and experts about how to continue to shape messaging. And we're at the beginning of what's going to be a long campaign here, but we will continue to make these recommendations absolutely based on the data, as we've been doing all along, and trying to be absolutely as transparent as we can be. That website is going to get busy. We're going to be putting a lot of information up there, creating a lot of materials, and working to really educate Chicagoans as we all learn about this vaccine.
And then just last question, the big party that was broken up over the weekend, as well as various restaurants that are ignoring, what's your reaction to all of that?
Yeah, I'm really disappointed when I see this. I'm thankful to the Business Affairs and Consumer Protection Division, certainly, and to our partners who have continued to work hard to enforce COVID regulations. At the Health Department, our sanitarians who do restaurant inspection to ensure food safety have also been doing a lot of COVID guidance enforcement. But, certainly I'm disappointed with the people hosting that party, but I'm also disappointed with the 300 people who thought it was a good idea to go to a party. And, I saw those pictures, as I know others did. And when I see numbers like we have in Chicago right now, right, 1 in 19 Chicagoans have COVID, You got 300 people? Like, do the math. There's a lot of people at that party, by statistically, who have COVID and are spreading it, and they weren't wearing masks. And it's when we're working as hard as we are as a city, and so many people have made so many sacrifices in their own personal lives. Our only goal is to get Chicago through this as quickly as we can. And things like large parties and things like people thinking they don't need to follow public health guidance is what sets us back. So I'm personally just disappointed. And, you know, it just means that the people who are doing the right thing have to do the right thing even longer when we have people doing the wrong thing.
Thank you.
Thank you.